Show me where the problem is on your body.
Right now, I'm getting little bit pain here. Little bit, very little.
Yes.
Otherwise, on that day, it was from here till legs going down. Okay.
Yes.
On the left hand side mostly, not on the right hand side. And one day I feel little bit pain on the hand also. So, but mostly the pain was here.
Yes.
On the lower back.
And how long had it been affecting you?
It was started last Saturday, and till Thursday I had a pain. But alhamdulillah, after that it's much better.
Alhamdulillah, alhamdulillah. What is the main reason that you've then come here? What are you trying to achieve?
I'm just trying to find out exactly what happened and try to mitigate it by the therapy or whatever.
We've found the problem area, and has it been understandable to you? The
Yes.
disc,
Yes.
it's clear, and so we realize that yes, pain level is down. However, the underlying cause, that disc and that joint, is there, and that's what we're going to address to make sure that the long term, not just the next 2 weeks, 3 weeks, but in the long term, inshallah, the future is good for you, inshallah. So let's begin, inshallah. Good. Then to the side. Other side. Slide your hand down the back of your thigh. I'm going to apply some pressure. Any pain? Yes or no?
No.
No. This side? Any pain? Yes or no?
You're very little, but yeah.
Into there, huh?
Yeah.
At the back. Alright, let's have you lie on your front. Loosen the spine. We're going to loosen the muscle with this vibrocussa. You'll be feeling the vibration. Is that okay for you?
Yeah.
So first, if you look to this side, this is a arthro stim. We're going to use it in the joint in the stiff areas. You'll feel a gentle vibration. You're going to feel a drop. We're going to move the hips and pelvis, okay? It's going to come up. We'll apply pressure and the table will give there.
Okay.
You're going to feel a pressure here. Breathe in, let it out. Good. Good. Let's have you sit up for me. There's a light here. When we switch on, there's going to be some heat in the back. Whereas red light going to go through right down to the disc. If it feels too much, you just let me know. 1, 2, 3, and go. Can you feel that?
Yeah, I can feel
feel
the
it?
hot air.
Now I want you to bend side to side. Now I want you to twist your body towards me one way and then the other way. Good. Full. More fuller. Good. Good. Okay, and relax. Bending forwards now, all the way, and then bending back towards me. Good, all the way back. Now forward. And back. Yes, forward. And back. All the way back, arch back, 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 back. Good. Relax for me. Nice. Nice. Lie on your back, please, facing up, knees up. Give yourself a hug. Now, this is going to help open up your posture. Hold here.